Greetings to one and all. Today's our topic under biochemistry is investigation of diabetes mellitus. So the objectives of today's presentation we have to discuss regarding what are the investigation we are going to observe if patient is suffering with diabetes mellitus. That is urinary testing. Under urinary testing we have to notify ketone investigation and microalbumin investigation. Then the second one is blood glucose estimation. Blood glucose estimation we have to be recorded with the glucometer. And another investigation is glycated hemoglobin estimation. So the following investigations are helpful in diagnosis of diabetes mellitus patient: urinary testing, blood glucose estimation, and glycated hemoglobin. It is also known as HbA1c or A1c. The first one is urinary testing. Urine test can be used for diagnosing and monitoring diabetes mellitus. Urine testing is less accurate than blood testing, but it is useful as a screening test for people who already know they have diabetes. So, in diabetes, urine is tested for the presence of three parameters. What are they? Glucose, ketones, and protein. And also, it is also known as microalbumin. So, the major three parameters of that urinary investigation under diabetes patients, we need to check for the how much glucose is present in the urine, and that is also known as glycosuria. And ketone bodies we have to analyze. It's an indication for complication of diabetic ketoacidosis. And what is a protein content identified in the urine, that is known as microalbumin investigation. So we having here different color codings given in the different ratios. Here has to be any strips urine dipstick will be notifying with that dipstick we have to analyze how much presence of glucose is present in the urine and what is the level of ketone bodies and what how much amount of albumin is going to be excreted in the urine per day. So glucose is not normally found in urine, but it can pass through the kidneys into the urine in people who have diabetes. In normal person, there is no presence of glucose in their urine, but it can pass from kidneys into the urine in people who have diabetes. If patient is suffering with diabetes, there is a presence of the glucose in their urine. Then urine glucose measurements are less reliable than blood glucose measurements. What we need to understand here, usually urine glucose measurements sometimes is less reliable than the blood glucose measurements and are not used to diagnose diabetes or to evaluate treatment for diabetes. They may be used for screening process. What do you mean by screening process? If you have any doubt the patient may be suffering with diabetes, initially we have to perform the urinary investigation. Then urine glucose can also be analyzed in people who are undiagnosed. Urine is tested for the presence of glucose by Benedict qualitative test, or it is also known as dipstick test. Why we are saying dipstick? The sticks we are dipping in the urine for checking the amount of protein or albumin or ketone bodies. So that's why we can say it is a dipstick test. Another terminology wise we can see it is a Benedict's qualitative test. The microalbumin test detects microalbumin, a type of protein in the urine. Protein is present in the urine when there is damage to the kidneys. What is a protein here? Albumin. Albumin is we can able to identify in the urine if patient is suffering with the diabetes mellitus. Since the damage of blood vessel that occurs as a complication of diabetes can lead to kidney problems, that is known as diabetic nephropathy. Nephron means kidney. So there is a damage to the nephron. That's why we are considering as a one of the complication for diabetes, diabetic nephropathy. Then another investigation is ketone bodies under urinary estimation. This test detects the presence of ketones in the urine. Ketones are formed from the fat when there is insufficient insulin to allow glucose to be used for fuel. So one concept we have to understand here, if there is no insulin in our body, the glucose will not be entering into the tissues. In that condition, our body is consuming excess fat. So in that fat, as for the energy source, in that condition, the ketoacidosis is going to be increasing. That is a condition we will not notifying as DKA, diabetic ketoacidosis. At high levels of ketones, ketoacidosis may be occur. And ketones can be detected by Rothera's qualitative test, is nitrofluoride reaction, or by dipstick test, by dipping a strip into a sample of urine. So whatever dipstick we are doing, we can analyze the protein, we can analyze the ketone bodies, and we can analyze the glucose, how much glucose level is present in the urine. A color change on the test strip signals the presence of ketones in the urine. Ketones occur most commonly in people with type 1 diabetes, but uncommonly people with uncontrolled type 2 diabetes. What do you mean uncontrolled? Though patient is not following proper dietary management or not taking proper medication, the diabetes may be uncontrolled. So uncontrolled means he cannot able to manage his blood sugar level at the normal ranges. That is known as uncontrolled type 2 diabetes may test positive for ketones. The presence of ketones in a person with diabetes may indicate a high blood glucose level. Another investigation under urinary estimation is microalbumin test. The microalbumin test detects microalbumin, a type of protein in the urine. Protein is present in the urine when there is damage to the kidneys. If there is a presence of this albumin in the urine, that is an indication for kidney damage. Since the damage to the blood vessel that occurs as a complication of diabetes can lead to kidney problems or kidney diseases, that is known as diabetic nephropathy. The microalbumin test is done to check for damage to the kidneys over time. The level of microalbumin can be detected by special albumin specific urine dipstick. The urine test is used may be referred to as dipstick test as it involves dipping a strip into the urine and reading the result using a color chart. The strip will be dipped into the urine sample during the test. The different blocks of color change indicates level of glucose, ketones and protein in the urine. So urine, how we are going to estimate there is a presence of albumin or ketone bodies and glucose. So there is a in the market there is availability of dipsticks to check for the protein content, then ketone bodies, then glucose content. Then another kind of blood investigation is that is blood glucose estimation. Blood glucose testing is more informative and safer than urine testing. Blood sugar levels estimated at. How we are going to estimate this blood sugar levels? Any time of the day without any prior preparation, it's known as random blood sugar. Within 24 hours, any time we are checking patient blood glucose level, that is known as RBS, random blood sugar levels. In the morning after an overnight fast, 8 to 12 hours is called fasting blood sugar. So fasting we know that without patient eating anything, we are going to measuring or monitoring his blood sugar levels at approximately 6 to 7 a.m. 6 to 7 a.m. that is known as blood sugar, fasting blood sugar, FPS. Then blood levels testing with the glucometer. So there is a device called glucometer. We can measure the patient blood glucose levels. So what is the steps we need to follow? Wash your hands using warm water. Prepare lancing device. There is a lancing device for pricking the index finger of the patient. Prepare a lancing device to get drop of blood for testing. Prick your finger and touch the test strip to get blood to the blood to begin investigation. There is a strip bottle will be there. So every time we have to take one strip for checking the patient blood glucose level. So that strip have to be attaching fixing towards the glucometer. So turn the meter on and insert a testing strip in it and wait for 8 seconds to view your test result. We have to take adequate sufficient amount of the blood. If it is excess or if it is less, the investigation or the strip may be getting failure. The 2 hours after a meal is called post-lunch or postprandial blood sugar. Post-lunch, after eating lunch. That is also known as PLBS or PPBS. Post-lunch or postprandial blood glucose level or blood sugar. Prandial in Latin means after food. And it is an enzymatic method using the highly specific enzyme, that is glucose oxidase, is used for the routine determination of blood glucose level. Whenever you are checking or whenever we are sending any blood sample to the laboratory, we have to notify what kind of blood sample we have to use for, or that is known as vacuum. What kind of vacuum we have to be used for such kind of investigation. For the healthy individual, the normal blood sugar levels are as follows. So here we can see the fasting. Fasting means before meals. Whenever you check any patient blood glucose level in the before meals, that is known as fasting. So the range is between the 72 and 99 milligram per deciliter. Postprandial blood sugar 2 hours after meal up to 140 milligram per deciliter. So postprandial. So that patient have to manage his blood sugar level at least 140 milligram per deciliter below. The random any time of the day below 200 milligram per deciliter. For people with diabetes, blood sugar levels target are as follows. Fasting before meals 126 milligram per deciliter or more. So what is this? For people with the diabetes, blood sugar levels target are as follows. If the patient is suffering with any diabetes, his fasting level at least he try to manage 126 milligram per deciliter or more. Then postprandial blood sugar 2 hours after meal. That is, he has to manage his blood glucose level 200 milligram per deciliter or more. Random any time of the day 200 milligram per deciliter or more. So here we can see in the diagrammatic representation of the blood glucose level. In the blood glucose test, what kind of investigation? Random testing, fasting testing, and 2-hour postprandial investigation. So normally we have the patient has to manage his blood sugar level below 200 milligram per deciliter. If it is fasting, below 100 milligram per deciliter. If 2-hour postprandial, below 140 milligram per deciliter. If the patient is diabetes, the ranges may be higher. In the random condition, 200 milligram per deciliter or more. Fasting condition, 126 milligram per deciliter or more. Then 2-hour postprandial, 200 milligram per deciliter or more. Then blood sugar testing with the glucometer. A glucometer is a portable electronic device for determining the approximate concentration of glucose in the blood. Glucometer measures sugar levels in a small drop of blood. A small drop of blood obtained by pricking the fingertip with a lancet is placed on a disposable test strip. The blood glucose meter reads and used to calculate the blood glucose level. The meter then displays the level in units of milligram per deciliter or millimole per liter. I hope student every day you are going to the clinicals and you are try to monitoring your patient blood glucose levels. And you have to read all the patient investigation belongs to the diabetes mellitus. Then only you can able to identify what is the normal ranges and what is the abnormal ranges. Then other investigation is glycated hemoglobin estimation. So many students may not be knowing regarding this investigation, but you have to and keep understand of this concept. So what they are saying here, glycated or glycosylated. One more term is known as glycosylated. So glycated hemoglobin is a form of hemoglobin that is bound to glucose. Glycated hemoglobin here Hemoglobin molecules is attaching towards a glucose, or glucose molecules is attaching towards the hemoglobin. The blood test for HbA1c, it is also known as HbA1c level, is routinely performed in people with type 1 and type 2 diabetes mellitus. Blood HbA1 levels are reflective of how well diabetes is controlled. Whereas when we used to see the fasting blood glucose level, random blood glucose level, we can notify the reading at the current time. Whereas this glycated hemoglobin estimation, we can estimate how best the patient is controlling his diabetes mellitus over past 2 to 3 months. Now you can see the picture here. Whenever we see this glucose plus hemoglobin in the red blood cell, there is a combination with the glucose and hemoglobin. So that is known as glycohemoglobin. Glyco means glucose, hemoglobin, Hb. Hb, these two molecules is combining, joining togetherly. So this is a concept. Normally we see the normal level ranges of RBC, our lifespan of RBC 120 days. If we see once this glucose molecule attaching to the RBC, we can estimate this since how many months onwards patient is controlling their blood glucose level. All about tests provide information about the patient glucose concentration only at that time and may be unreliable of overall control. HbA1c better than fasting glucose for determining the control on diabetes mellitus of a patient. The RBCs of all people contain a small portion of the HbA1c. Usually the normal person who don't have diabetes, they'll be having less A1C level. The rate of its formation is proportional to the glucose level, and so person with diabetes have a higher proportion of HbA1c than do normal individual. For people without diabetes, the normal range of A1C level is between 4 and 5.6 percentage. So here the glycated hemoglobin level is measuring in the percentage. In normal population or the normal person who don't have diabetes, they when you check his glycated hemoglobin, the level approximately 4 and 5.6 percentage. HbA1c level between 5.7 and 6.4 percentage means you have a higher chance of getting diabetes. That is also known as pre-diabetic condition. Pre-diabetic condition, there is a frequent fluctuation of this A1C level. Sometimes it may be between 5.7 and then 6.4 percentage. Levels of 6.5 percentage or higher means we having diabetes. Once A1C formed is remained within the red blood cell of its lifespan 120 days. HbA1c test tell about average level of blood sugar over the past 2 to 3 months. Estimation of A1c level in blood is used as a guide to the degree of control over a long period. An elevated A1C indicates poor control of blood glucose level in the previous 2 to 3 months and can guide the physician in selection of appropriate treatment. Now you understood this. An elevated A1C level indicates poor control of blood glucose level in the previous 2 to 3 months and can guide the physician. This endocrinologist can be suggested for what kind of management can be processed for the patient. So let us summarize our topics. So far we have discussed regarding investigation of diabetes mellitus. So in that investigation, the first initial methods we are checking for the urinary testing. In the urinary testing, we are going to measure the ketone bodies, protein level, and then glucose content. So this is a ketone test we can notify here. Microalbumin. Albumin is a protein. If the patient is having kidney damage, the albumin presence of albumin in the urine will be notifying. That is all. Some usually will say microalbumin. Then blood glucose estimation, we have to remember this blood glucose estimation. Initially, we have to monitor the patient blood glucose level with the glucometer. Glucometer is an electronic device. We have to insert a strip in that, and after by using the lancet, we need to prick the index finger of the patient for collecting of the small amount of the blood for estimation. Then that is the meaning is blood sugar estimating with a glucometer. You all must be knowing that how to operate the glucometer and how we have to trace the blood glucose level from the patient. And the last investigation we have discussed in this topic is that is glycated hemoglobin. So what is another name of glycated hemoglobin? That is HbA1c or A1c. So when there is a in normal patient, this a normal population or normal healthy patient, the A1c levels are less. If the patient is suffering with the diabetes and it's uncontrolled diabetes, the percentage of the glycated hemoglobin level will be variation. Sometimes it is more than 7%. That is indicating is he is diabetic. If it is ranges 5.5 or 6, so in some time we can suggest for patient may be having in the future he may be developing as a diabetes. Initially we notifying this glycated fluctuation in the pre-diabetic condition. Once the patient is diagnosed with the diabetes condition, he have to control his blood glucose estimation. I hope my students, you have to be analyzed day to day your preclinical practice. You have to take different kind of patient records and you have to analyze the different kind of investigation. So that will be helpful for you to update your knowledge regarding the diabetes mellitus investigations. I hope my dear students you understood this concept. So I hope so that have a nice day. We will meet once again.